Well, the thing is that people have to understand that menopause, like people, are all unique, and every person has their own experience. And also, they have to realize, it's important to realize that menopause is not about an age, it's about a transition, like puberty backwards. And for the majority of women will go into menopause at about age 51 or thereabouts within that window. But 5 to 10% of women are going to go into menopause before age 45. They'll be in menopause before age 45 and 1% before 40. And the symptoms are going to start up to 10 years before menopause happens. So we have to realize that if you're having symptoms, if your bladder isn't acting right, if your vaginal tissues are dry, if you're having brain fog, it's not, these are not things that you have to go to the psychiatrist for your anxiety and for your depression or for your brain fog, and you don't have to go to the urologist for the bladder, and you don't have to go, you just have to realize that it could be all of this is under one thing. And many examples have been shown of women who go complaining of these things in the emergency room and then go home and have a heart attack. And the reason for that is because men tend to have closing of the arteries in their bigger arteries, and women tend to have more what's called microvascular disease, or narrowing of the little tributaries off of those big arteries that are smaller, and so the symptoms present in a very different way.
Yeah, it's very important for women to know, obviously, this and seek medical attention. So because, as I remember, we learned in medical school that the silent heart attack, which is, partially what you're describing, is very common in women after the menopause.
What are you trying to learn here? And they said, oh, we know hormones are good. We never stop taking them. But our daughters are nervous about it. So here are these mothers in their 70s still worrying about their daughters who are in their 50s. And they want to make sure that their daughters don't miss out, because the younger women are really trying to tough it out as opposed to figuring it out. And as a result, they're dealing with the consequences of not benefiting from the upside of hormone therapy.
Cures, Remedies, and Beyond podcast with Dr. Irina, a Stanford-trained medical doctor, inventor, and a published author with over 30 years of clinical experience, is bringing together the science of medicine and the art of healing for ultimate vitality and health. It engages in discussions with healthcare providers, wellness experts, innovators, philosophers, spiritual and industry leaders, as well as health and wisdom seekers, to provide you, the listeners, with practical tips and knowledge to help optimize your health and well-being. The Cures, Remedies, and Beyond podcast with Dr. Irina.
Welcome to the show. Today our topic is menopause. In particular, menopause in the workplace. Almost 40 million working women in the United States in their 40s and beyond will discover that the symptoms of perimenopause or premenopause and menopause will intrude on their workday. For some, the transition will be almost unnoticeable, but for others, it will be debilitating. According to some statistics, 1 in 4 women who experience menopausal symptoms consider leaving their jobs. As we know, menopause can not only affect the women's bodies, but also the brain, causing anxiety, panic attacks, depression, or brain fog. To talk about this very important topic and about what can we do about that, we have invited Dr. Mache Seibel. Thank you for joining us, Dr. Mache.
It's my pleasure. I'm delighted to be here and participate in your new and exciting podcast. My pleasure.
You're not only a medical doctor, an OBGYN who worked for Harvard Medical School, but you are also a prolific writer. You're also a speaker, a coach, and a leading expert on women's health, as well as estrogen and menopause. I know that in your prior specialty life, so to speak, you were primarily focusing on opposite spectrum of menopause, the fertility, helping people obviously conceive and have their children. So my question is, what got you interested in this topic, in menopause, Maish?
Yeah, it's true. I used to do what I say sperm to term, and now I do womb to tomb. But my area of interest actually transitioned and on a personal matter because my wife had surgery that threw her into early menopause. And it was only 6 months after a study called the Women's Health Initiative came out, the so called WHI. And that study incorrectly reported that estrogen hormones could lead to an increased risk of breast cancer and an increased
Right.
risk of heart disease and a number of other things. And part of the thing that I did was to do research to try and see if that was accurate or not, because it was difficult to find providers who were comfortable offering estrogen. Many of them refused to do it.
Mm-hmm.
And it turned out the number of women went from about 50% of women in the country being on hormone therapy down to about 5%. So it was a tenfold drop in estrogen use. And that number is still accurate. It's still about 5% aren't taking hormone therapy. And because of that transition and the need to know and to figure it out rather than have to tough it out, I decided to transition as well. And I moved from the fertility domain into the menopause arena.
Mm. How old, if I may ask, was your wife when she got into that early menopause?
She was about 46 or 47, I don't remember, but still very young and
Pretty
still
young.
menstruating regularly. So her own personal hormones at that time um, were at a very, high level, not high, but the very normal level. And she had a family history in her women in her family, many of them, so many, had died because of ovarian cancer. And it turns out just around that time, there was a paper in the New England Journal, pardon me, that said that women who have certain genes, in this case it was a BRCA or BRCA or breast and cancer, uh, merged together into a shortened word. But people who had that were at increased risk of breast cancer and ovarian cancer, and also some other cancers like pancreatic cancer and even melanoma. And then what happened was the article came out that showed that if you had your fallopian tubes and ovaries removed, you lowered the risk of those cancers by 60 to 80%, depending on what type of cancer you were talking about. So when that became possible, she had that procedure done, but it happened to coincide just after that Women's Health Initiative study came out saying hormones were bad, and that's when she actually needed them very badly.
Mm-hmm. And what did you investigate? Because obviously you looked at the studies, as you mentioned, the Women's Initiative, very famous study that, of course, scared a lot of women. And so I'm just curious, what was your conclusion?
Well, the thing is that the study was the largest study in the country it ever had at that time.
Right.
And estrogen was the number one prescription medicine in the United States. Number one, it was about a $7 billion medication. And
Oh.
what I looked at was the study design. And the study was well intended, but very, very poorly done. And the reason is as follows. The purpose of the study was to compare women who had a placebo or a sugar pill to women who took either estrogen by itself, or if the women had a uterus, they had to take estrogen and progesterone or progesterone type medicine together to protect the uterine lining. So it compared either women who got the placebo sugar pill to women with hormones. And the study was supposed to include women between the ages of 50 and 79 years old. But the thing that went wrong was there were so many women who were taking hormones that they couldn't find enough women who weren't taking hormones to get into the study. And so they ended up with the 75% of the women who got the placebo being between 50 and 59 years old, and only 25% being between 59 and 79, or 60 and 79. And the women who got the hormones, 75% of them were between the ages of 60 and 79, because they couldn't find the younger women who weren't already on hormones, because that's when many of the symptoms are. So the study ended up comparing women in their 60s and 70s to women in their 50s. The women in their 60s and 70s were getting the hormones, but women in their 60s and 70s are going to have more medical problems than women in their. And so what happened was, when you took the same, not a new study, the same study, and when you superimposed the women who got hormones between their 50 and 59 years with the women who got the sugar pill, all of the problems went away. There was no increased risk of cancer and no increased heart disease and so forth. As a matter of fact, if you take estrogen alone, let's say you're a woman who's had a hysterectomy, and therefore you would only need estrogen. You wouldn't need estrogen together with progestin or progesterone in order to protect the uterine lining. So if you were a woman without a uterus, had a hysterectomy, and you took estrogen only, your risk of breast cancer would actually go down about 23%. And
Wow.
this is all something that most women were unaware of, and most of the doctors, because in my books, I wrote 2 books, The Estrogen Window initially, and then it was followed by another called The Estrogen Fix. And when I was going on book tours and I talked to both lay and to professional audiences, a great many of the people had no clue. And what was interesting to me was, many times when I would have lay, talk to the public, I would talk to them, and many of the women in the audience would be like in their 70s or older than, early like 50. And at some point, I just decided to ask them, excuse me for asking, but, you are somebody who seems to be kind of beyond the time when many women would still be on hormones. Why are you here at my talk? What are you trying to learn here? And they said, oh, we know hormones are good. We never stopped taking them, but our daughters are nervous about it. So here are these mothers in their 70s still worrying about their daughters who are in their 50s, and they want to make sure that their daughters don't miss out, because the younger women are really trying to tough it out as opposed to figuring it out. And as a result, they're dealing with the consequences of not benefiting from the upside of hormone therapy. Not saying it's for everyone, and I'm not saying everyone has to be on it. I'm just saying, if you want it, the majority of women are going to find that it's both safe and beneficial.
So, and could you tell us a little bit more, like, what is menopause and how is it different, let's say, from perimenopause?
Well, you have puberty, and your hormones sort of begin to change and go from very low levels to kind of not quite balanced. And then finally, you get into your reproductive years where you have higher levels of hormones, and they're very balanced. The hormones are the estrogen, the progesterone, kind of like paired figure skaters. They go together very perfectly. And at the end of every month, the hormone levels drop. And if you're not pregnant, the lining of the uterus will shed, and the woman has a period, and then the hormones start up again. So then at the end of the reproductive years, somewhere, and it could be at a wide range of ages, and we can talk about that in a minute. But then what happens is the body starts to have the hormones become unbalanced again, kind of like puberty, but backwards. And the same kinds of things happen. There's menstrual irregularities. There's those mood changes you may have had when you were going through puberty. There's changes in the skin. There's changes in how interested you may be in sex. There's interest changes in a lot of different ways. And then at some point, it's also during that period a little bit harder to get pregnant because most of the eggs that the woman has, she was actually born with all the eggs she's going to get. And most of those eggs are going to have ovulated or been used over the course of her life from the time of puberty when she's having her first ovulations to the time of menopause. So over that period of time, the number of eggs reduces, the amount of estrogen goes down. And then what ends up happening, the woman's in menopause, which is by definition 1 year after a last menstrual period, if it's natural. If you're a woman who's, say, 40 and you end up having a reason to have your ovaries out, maybe you want to prevent a cancer from happening, so you, like my wife did, and have her
Right.
ovaries removed at an earlier time. That's called surgical menopause, not natural menopause, because your hormone levels are up here, and then poof, they take them out, and then they drop rapidly, and the symptoms are quite intense for women. Whereas natural menopause, the hormone levels drift down gradually, and the symptoms come upon the woman in a more gradual way.
Yeah, and talking about the symptoms, so I mean, some symptoms can be just more like a trivial, nuisances, but some symptoms can be quite serious, as well as the consequences for the,
Right.
future, so to speak, for women in the cardiovascular health, so mental, etc. So, yeah, could you tell us what type of symptoms typically women need to be aware of, and especially those that can really affect their productivity, their overall life, as a human being, not as just a woman?
Well, I divide symptoms into two categories. I call them the silent symptoms and the noisy symptoms. And the noisy symptoms are things like hot flashes. Most women know somebody who's had hot flashes around them, and they start to have a sudden burst of heat and warmth, and it causes a flushing of the face and the upper chest, and sometimes sweating. And those hot flashes, they can be mild or moderate or severe. And of course, the worse they are, the more impact they have. But women know they have them, and those are very noisy.
Mm-hmm.
Other kinds of noisy things may be the bladder symptoms that change. A woman gets a more sensitive bladder. She may start to have issues like if she goes to play tennis or go running or picking up something that's heavy and she's kind of bearing down or weight a little bit. She may find that she loses a little bit of urine. Uh, and
Like a stress incontinence, as we call it, right? So
exactly, that's what it is. And then, there are also changes in the estrogen levels in the brain, and that can end up causing anxiety, which is incredibly common, and they can cause a depression, not being clinically depressed, which is a much more serious level of depression, but feeling sad. And it can cause mood changes where a person can really, somebody can just say something that's very minor and the person may blow up. And it has nothing to do with what was said or what was, the person's intention. Or it could be that they find that they have brain fog, which is a very common symptom. And many women will say, I'm a little bit worried that I'm going to get dementia or I'm having dementia because I can't remember things. I know one lady told me that she was asked to pick up some dog food on the way home when she picked up the kids. And she walked in and um, all of a sudden she kind of slapped her face and the husband says, like, where is the dog food? And she says, oh, I got the dog food. He said, well, okay, but where are the kids? I mean, she forgot to pick up everything on the way home. So people
oh
can
my God, yeah, the
so
memory.
anyway,
Mm-hmm.
So there are these noisy kinds of symptoms. Some people may notice difference in hair on their face, or get a kind of a unibrow, or they may notice changes in the dryness of their vaginal canal and so forth, where pain may become more uncomfortable. On the other hand, there are silent symptoms, and the ones that are really worrisome for there are things like osteoporosis or thinning of the bones, because most women or most men too, most people don't know they have osteoporosis if they don't get a bone density. They won't know it until they break something, and
Right.
then find out. So osteoporosis is a very important condition for women because a healthy 50-year-old woman is just as likely to die from a complication of osteoporosis, like a hip fracture, as she is from breast cancer. But people, know they're supposed to get a pink ribbon and a mammogram, but not everybody's getting a bone density, which would be able to tell that. Or something like colon cancer, for instance, which might be very silent until you start having bleeding from a polyp or something that has changed from a benign polyp to a malignant growth. And so
Tells you
it
that it's way too late almost, yeah.
yeah, and also heart disease sneaks up on women and men, but it sneaks up on women because they don't realize their arteries are narrowing and they're more at risk of a heart attack or a stroke or other things. And symptoms of heart disease are very different in women than in men. Men get these, tend to get, the pain in the left arm and the serious pressure on their chest, and they feel like there's an elephant on their chest. So women, on the other hand, may simply have a little bit of nausea, or they may have at the angle of the jaw, they may have some discomfort or sweating. They may have a kind of a diffuse, upset stomach. It can be very seemingly minor things, and many examples have been shown of women who go complaining of these things in the emergency room and then go home and have a heart attack. And the reason for that is because men tend to have closing of the arteries in their bigger arteries, and women tend to have more what's called microvascular disease, or narrowing of the little tributaries off of those big arteries that are smaller, and so the symptoms present in a very different way.
Yeah, it's very important for women to know, obviously, this and seek medical attention. So, because, as I remember, we learned in medical school that the silent heart attack, which is, partially what you're describing, is very common in women after the menopause. So, and it's super serious, of course. Yeah.
When I see women for coaching, like I do menopause coaching, and when I talk to women, one of the things I try to do is to make sure that they are taking care of themselves in a proactive way, because in the short visits that go on in the doctor's office, a lot of times these routine things are overlooked, or they just aren't being handled in a ongoing way and followed up with. And I think it's very important that people try to stay out of trouble rather than get out of trouble.
Right, yeah. And how long do menopausal symptoms last?
Oh, they can last. The average window of time is about 5 to 7 years. Some women will have symptoms for 2 to 3 years. If they're fortunate, that's a short time, of course. And some women will have symptoms that can last for 10, 11 years. A small subset of women, about 7%, will continue even up to 20 years. I mean, it can really be a long time. So, is it normal to be 65 and having hot flashes? Yeah, it's not common, but it's normal. And, hot flashes can come from other things besides menopause. That menopause is overwhelmingly the most common, but I mean, it could be from low blood sugar. You can have hot flashes and issues to do with, sweats and so forth, or thyroid disease or other conditions can mimic it. But for most of the time, it's hot flashes is due to menopause, but you need to talk to someone and make sure.
Right, yeah. It was interesting for me also to learn that talking about menopause in the workplace, that I read that menopause cost American women an estimated 1.8 billion in lost working time per year, according to Mayo Clinic study published in 2023. So that was really staggering statistics for me to learn. So I didn't know that. So, and that kind of brings me to next question. So what can we do about it? And like, what would you suggest women to really take, specific hormone replacement? There are also different types of hormone replacement, identical, this and that. So there's a lot of misconception going on around, of course. What's your typical suggestion?
Well, the thing is that people have to understand that menopause, like people, are all unique, and every person has their own experience. And also, they have to realize, it's important to realize that menopause is not about an age, it's about a transition, like puberty backwards. And for the majority of women will go into menopause at about age 51 or thereabouts within that window. But 5 to 10% of women are going to go into menopause before age 45. They'll be in menopause before age 45 and 1% before 40. And the symptoms are going to start up to 10 years before menopause happens. So we have to realize that if you're having symptoms, if your bladder isn't acting right, if your vaginal tissues are dry, if you're having brain fog, if it's not, these are not things that you have to go to the psychiatrist for your anxiety and for your depression or for your brain fog, and you don't have to go to the urologist for the bladder, and you don't have to go, you just have to realize that it could be all of this is under one thing. And the second part is that some women are not going to go into menopause, about 5%, until they're after 55 or even after 60. So it's a curve, bell-shaped curve, and some will be on the extreme far end and some on the early end. So, what they need to do is, the couple of things I would say is that these are generalizations. And as Mark Twain said, all generalizations are inaccurate, including this one. But I will say that what's important is, if you're a woman who's in her mid 30s, you're thinking about having kids, do it, because you never know what's going to happen in the future. And it becomes harder and harder and it takes longer and longer to get pregnant the quote older you get. That's, of course, a very young woman. But for some of those women who are 35 or 40, they're going to be in perimenopause. And perimenopause is that window of years, up to 10 years, that leads from reproduction being normal to reproduction stopping and period stopping. So that's perimenopause, like the perimeter, around, and it's around menopause. So what should they do? The first thing they should do is, if they think, is to figure out if you're really in menopause. And you can do that. There's no one test for menopause per se, but there are some blood tests that can give you a clue that you're approaching it. There's a blood test called FSH, F like Frank. It stands for follicle stimulating hormone. And generally, the FSH is in the pituitary gland, and the follicle is the little fluid-filled sac that contains an egg. And every month, the FSH goes up. It tells the ovary to make a follicle, and that's the one that's going to ovulate. And then it also makes estrogen, which will then turn off the FSH. And then the ovulation happens, it all goes down and it starts up. But as you approach menopause, the FSH will start to go up, but because the ovary is not listening too carefully, because there are fewer eggs and they're more resistant, then what happens is you get a little bit higher FSH. And then, so that test is probably the simplest to get. But the most important thing to recognize is get diagnosed. The second most important thing to recognize is that for every symptom in menopause, there are several types of treatments. And so it's important to realize that you can get treated, and do not fail to seek treatment, particularly for relief of your symptoms. And then there's a whole host of symptoms which we can talk about in a little bit more detail. Not
Yeah.
a whole host of treatments, I meant to say.
Right. So And as I guess what you're saying is that we could approach it not necessarily with the hormone replacement. Not every woman would be interested in that. So, but there are definitely a lot of different options that women
Yeah,
can find, including the alternative options, including the prescription non-hormonal treatments, correct?
there's lifestyle changes you can make that are very important. And I think whether you get other treatments or not, changing your lifestyle is going to be the baseline for your life. And it's very important. And we can
Yeah.
talk about that in a minute. The second thing is there are some over the counter things that can be helpful in the short term, depending on your symptoms. The third thing is that there are a number of alternative types of um treatments that can fall under anything from acupuncture to uh,
Supplements,
yeah,
herbal, yeah. Mhm.
right.
So yeah, and what type of treatments would you recommend? So or lifestyle?
Well, there are a whole lot of things for treatment. What I'll do is just give you a summary of the overview of those things, and we can go in more detail if you'd like to. Uh, of course, one thing that everyone should be trying to do is to modify their lifestyle, and lifestyle includes things like getting more sleep, getting less stress. It's always good to lower stress if you can, and to get enough exercise, and to um, try to have a diet that consumes a lot of vegetables and whole foods, and try to limit sugar, salts, and of course uh, saturated fats. The second area is um, complementary and alternative types of treatments, and that could be supplements, it could be acupuncture, chiropractic, it could be a whole host of things that we could also talk about in more detail. The third area is over the counter medication, not medications, but over the counter supplements and other forms of treatments that you can get in a variety of sources. And then there are prescription non hormonal medications and some very exciting ones that have come out just the latest one came out in May of 2023, but there are more around the corner, specifically for hot flashes. But there are treatments for a variety of things that are not hormonal but prescription. And then finally, hormone therapy, which of course is no question the most effective and uh, the most holistic in the terms of taking care of the whole person. But so then we could break down those, if you would like, into
Yeah.
more specific things.
Yeah, I would like that. So, but let's take a very quick break. We will be right back and we will continue with your recommendations.
This podcast represents the personal views and opinions of the host and the guests and does not constitute medical advice. The statements contained in this podcast have not been evaluated by the FDA. Any products or treatments mentioned are not intended to diagnose, treat, or prevent any disease. And now your host, Dr. Irina.
So I like those categories. Makes it much more clear, I guess, for me to understand. So if you don't mind, Mish, could you expand a little bit more, let's say, on specific prescription medications? You mentioned a new one. So what's the name of that one for hot flashes that is non-hormonal?
There's a whole new category of medications that have the first one has been approved in May of 2023, and there is another one that's due to be approved in 2024. But the name of that particular one is called, the generic name is fezolinetant, and it goes by a trade name of Veozah, Veozah, I think. And there is another one coming out soon called elinzanetant. These are names you don't have to worry about because you're going to be seeing more about it. But how these work, which is really interesting,
Yeah.
is because of the fear surrounding hormone therapy, a lot of women they're still worried about taking hormones. Even though the vast majority of women don't need to worry about it, they do. And so particularly if they have breast cancer or some other cause of concern where estrogen would be particularly worrisome for them. And so these medications work on the thermostat of the brain. And there is a place in the hypothalamus that is regulating temperature. And in particular, in women, when estrogen goes down, the thing that's inhibiting temperature rises is gone. And so the thing that stimulates them is still present and making hot flashes come at a higher rate and the person feeling more warm. These new medications are a particular type of very specific protein receptor blocker. And what that means, very simply, is the thing that turns the heat up is being blocked. So estrogen
Mhm.
is low, which would turn the heat off, but the thing that turns it up is being blocked by these new medications. So
That's really interesting.
it's a daily pill. I think it's 45 milligram pill. It's once a day, and it's getting good effects. It's fairly new. It's got some potential things to be concerned about for a small percentage of the population. So the doctors will get a blood test to check your liver enzymes and make sure that nothing is a problem. They check them every 3 months for a year or so. And then if everything is fine, then it falls into once a year they check it. But this is just to be safe. For the by and
Mhm.
large, these are safe medicines, and they're getting very widely accepted.
That's really interesting. And actually, I have a little side question here. So, like, if somebody, let's say, wants to go natural, so to speak, with the hot flashes, but we all know that there are some triggers. So, what are those common triggers that women need to be aware of, so to avoid and basically not to provoke that thermoregulatory center, as you said, in our hypothalamus in our brain?
Well, there are a number of things. I mean, if you get into a hot setting, like if the temperature in the room is hot, then it certainly will have a tendency to trigger hot flashes. If you are a person who gets stressed, stress is a symptom of menopause and it can also trigger hot flashes. If you are somebody who is exposed to things like coffee, caffeine, if you are exposed to things like alcohol, hot, spicy foods, hot in the sense of spice and not in terms of temperature, uh, those are potential triggers for hot flashes. So these are some of the very common things that women can try to minimize. But as I said, uh, there are there are a number of things that women can do, then a number of treatments. And that medication, this new medication, isn't the only prescription non-hormone. There's another. There is another one called Brisdale, which is one that is actually a very low dose of the antidepressant paroxetine,
Hmm.
and it's taken at bedtime because it tends to make you sleepy anyway, and that can be useful for hot flashes. It's not a good enough dose. The dose is too low for antidepressant. It's actually very low dose, but it does work on reducing the heat for hot flashes. And there is, of course, the hormone therapy, which is the one medicine other that has been approved for treatment of hot flashes for decades, and is
Right.
very effective. The thing that you have to remember when you do a treatment, if you do take hormone therapy, the benefit of it is that there are receptors for hormone for estrogen on almost every cell in the body, in the brain, in the skin, in the breast, in the vagina, in the bladder, in the GI tract, everywhere in the body. So if you
Right.
take hormones like estrogen, then you are treating what's going on in the sum of you. But if you take something for just hot flashes, you're only treating some of you. And
That's a
so it's
good way
very
of saying
important.
it.
Yeah. But what matters
Mhm.
is if you're going to go with something other than hormone therapy, and this is what I emphasize with women that I work with for coaching, is that you have to realize that all these other parts of you, some of those symptoms will be noisy and you'll know them, and some will be silent, as we talked about earlier. And you've got to take care of the sum of you in order to make sure that you're treating your whole entire body. And that's body, mind, and spirit. That's your brain and your body and in all of the other parts that are so important.
Yeah, yeah, no, that's well said, of course. So, and uh, I would like to continue a little bit more on the hormone replacement, but before going there, so you did mention some alternative, like supplement type of, not even medications, but just food additives or specific types of food, perhaps, that you would suggest
Mm-hmm.
women to consider to, control some of those symptoms, particularly hot flashes. So, what do you typically recommend to your women?
Well, if they want to try supplements, I mean, always if you're going to take something, food, the whole food that it's in is always better than the supplement that
Right.
extracts a piece of it out. But I've written an entire book on soy. It's called The Soy Solution for Menopause. And that book goes into and explains how soy can lower hot flashes just a little bit. It can lower them about 30%. And hot flashes are, have two measurements. They're uh, how frequent they come and how much intensity there is, how hot they are.
Mhm.
And so soy can lower about 30% in the intensity and the frequency.
Hmm.
And so that's beneficial. It's not going to be like taking hormone therapy, but it is a plant estrogen. It's very weak. People would take between 50 and 200 milligrams a day as the dose, and you would divide the dose, twice 12-hour twice a day. You don't have to set your clock for it. Just take it at breakfast, take it at dinner. Alternatively, you can eat one of the many soy foods. You can eat tofu, you can eat soybeans, you can eat tempeh, you can eat, any of the miso. There's so many kinds of soy in soy foods and dishes. So you can eat that. Uh,
And you
and
have a book of the recipes, I believe,
yeah,
yeah, that's really fantastic. So, what do you
yeah.
think
So,
of all this additional, like, black cohosh, the flaxseed oil that, I mean, everybody reads about? I mean, do they really work?
my philosophy is that everything works for somebody and nothing works for everybody. And so the way you have to do it, and what I recommend to people when I work with them, is to you try to take one thing at a time. In other words, don't go taking a handful of different supplements and stuff because you
Mm.
don't know if you need all of them. If it works, you don't know if you need them all or you just need one of them is doing the work for you. So black cohosh is a root that was actually used by Native Americans uh, for hot flashes and for other kinds of quote female conditions. And it was exported to Germany, and then Germany manufactured it in a very refined way. So it's very specific, and it is something that's very commonly used for hot flashes. Uh, Flaxseed is another type of um, plant estrogen. It contains substances which can lower hot flashes. The best way to get that is basically you have to keep it refrigerated or it turns rancid. So
Mm.
you have to get it fresh and make sure it's fresh and keep it in the refrigerator. And ideally, you just get it ground. And a lot of people will just take it and sprinkle it on cereal, for instance, on top of oatmeal or cereal, regular cold cereal, a tablespoon or two, and use that daily. And that's another something that you can try. But as I said, the best way to do it if you're going to try supplements is to go for about a 3-month window, 2-month window, use it. It's either helping you or it's not. If it is, keep using it. If it's not, don't use it and get the next one. And
Mhm.
because otherwise, you're not going to know what you're doing and you won't know what's working and what's not. And also, you start taking all these different supplements, it's going to be costing you a lot of money because all of it adds up together.
Mm-hmm. Yeah, that's so true.
There's a number of proprietary things that are on the market. I don't tend to use them or recommend them as much because I don't actually know what's in them, because they're trying to have,
Nobody regulates that industry, as we know. Yeah. And
and
unless they're tested by the independent labs, so it's really hard to control. Yeah, I agree. Yeah. So, and going back to the hormone replacement. So those women that want to obviously offset not only their symptoms, but they want that protective effect of the estrogens, as we know, for your heart, your cardiovascular system, for your brain particularly, right? So they choose to go on the hormone replacement. First question is, when do you recommend them to start? Is it in a perimenopause? Is it right after menopause? It's a few years from the start of the menopause. What's the optimal time frame?
the most important thing is to start it close to the time of menopause, because that's what my first book on estrogen was about, the estrogen window. It's actually, I had that book here. It's called The Estrogen Window. But it's a window of time. And so we know that estrogen is safest when you take it within the first 10 years of menopause. And you ideally start, if you go into menopause early, let's just say at age 45 instead of 50, or age 40, you need to start it then and then continue it until at least the time of natural menopause, which is about age 51. You can continue it longer, but you would take it.
And then just to ask you, clarify, and the reason for that is so that there is no irreversible, so to speak, change happens, and then already estrogen, even if you supplement, is not going to work. Is that why?
Yeah, basically, if you're not taking hormones after menopause, your body is aging. Your arteries are putting plaque down, and there are things going on in your body as an aging process, and estrogen helps to slow that down. So if you wait until you are, let's say 60, 65 in particular, and start hormone therapy then, it's probably a little less, it's not probably, it's a little less safe than it would be if you started it at 55 or closer to the time of menopause, within 10 years of menopause starting. When you're in perimenopause, what's interesting is that's not a time of low estrogen, because what happens is the ovary has still a number of eggs in it, but they often will not ovulate. And so it's the ovulation that makes the progesterone. The eggs before ovulation make only estrogen, and then after ovulation, they make progesterone. And that's what keeps them balanced. So what happens is if a woman is in perimenopause, particularly later in perimenopause, close to menopause, what's going to happen is that many of those eggs won't ovulate. So they keep making estrogen, they keep making estrogen, they keep making estrogen. Estrogen actually gets quite high.
Mm-hmm.
So then you only need progesterone in the perimenopause primarily for most women.
Oh, interesting.
It's
That's
all
what.
generally speaking, because I can't say for any, for
Of
every.
course, of course. Yeah, it's so, and that's what's caused. People call unopposed estrogen, and that's why women tend to gain weight and have some other
Well, they have
symptoms.
bleeding and stuff like that and other issues because they have breakthrough bleeding, because the progesterone, the purpose of the progesterone is progestation. And so it's for pregnancy.
Right.
So what happens is the estrogen makes the lining get thicker of the uterus. The lining of the uterus gets thicker. And the progesterone then compresses it and stabilizes it so it's just right to receive a fertilized egg. And if you don't have the progesterone, the lining keeps building up and building up and building up. Eventually, some of it breaks off and it causes bleeding. And that's why if you take estrogen, if you have a uterus and you take estrogen for 10 years or 15 years without progesterone, there's a risk that some of that lining could turn into precancerous cells. If you take progesterone with it, it just doesn't happen because you're not allowing the the sequence of events to make it evolve into a potential risk for cancer. So that's why it's important.
And another question is, once you start taking hormone therapy, do you have to stay on it?
You don't have to. I always tell people that I work with that hormone therapy is basically a 5-year renewable option. And so what you do is you try and get the most benefit out of it. And then at some point, if you decide you don't want to take it anymore, then you can stop taking it. It's not an addictive medication.
Right.
It is very comforting, though, to not have symptoms. And if you took estrogen for hot flashes, sometimes about up to 30% of women will get hot flashes again when they come off of estrogen. So some of those women may want to stay on it for that reason. And also, it's also possible that that you will have a benefit from just a lower dose. So generally, as women get to be around 65 or thereabouts, start lowering the amounts they get just to lower their risk and exposure. And generally, they don't miss it. You just take it down gradually, and they're
Tapering it off.
yeah, you don't have to taper it to zero. You can just taper it to the next step down.
That's really interesting. So, and I know that you're also a coach. So that was really incredible, I guess, service for especially working women that are going through this type of new phase in life. So it's not necessarily a bad phase; it's just a phase, right?
It's as natural as puberty. And
Right.
that's why we did this book called Working Through Menopause, The Impact on Women, Businesses, and the Bottom Line. And I did that together with my wife, Sharon. And that book is important in the coaching, which is available at menopausecoaching.com. Women can work one-on-one or in small groups, and it helps them to really go through this, and particularly for women in the workplace, particularly women who are executives and women who are really in a position where they have to be functioning at their peak. It often get to that point in their careers just about the time menopause happens. And so it's very important to be able to have the opportunity to get help to cope with the symptoms so that you're getting an absolute optimization of your menopause.
Health and well-being, exactly. So, and kind of regaining control over your life in a certain way. So, and relationship and everything. So, yeah, I like that you have such a comprehensive approach. So, to your coaching and to your treatment. So that's really beautiful. So, and you obviously helped thousands of women, as I read, so which was really impressive.
1,000 women, that's a lot of people.
So yeah, I have to say that I'm really impressed with your dedication, Mash, to helping women. So as we know, menopausal symptoms might affect roughly 25% of the US working population at any given time. So that's a lot of wasted, I guess, hours potentially. So, and you're really coaching women, you're helping them with your advice. So you actually can really take them, through the process and help them navigate medical system, which we know becoming more and more cumbersome and more and more difficult to navigate. So, and it's really wonderful that we have you, as an expert. So, and I'm glad to actually learn that you have been a host for several PBS TV shows. You have been on Dr. Oz's advisory board. So that's really impressive to learn about you. So, yeah. And I also know that you are an amazing award-winning musician and a songwriter. So I was wondering if you could actually play something for us.
Sure, I can. I play you a song. It's a very simple song. It's called a happy song. And I wrote this song one day when I was having a terrible day. And I was I don't know if you can hear it or not.
Yeah.
Yeah, I had a very early day to be at work, and my alarm didn't go off. And so I got up and I went downstairs and I put some toast in the toaster so I'd have something to eat. And the toast burned. And so I went out. I said, well, I'm not going to have anything to eat, so I'll just go outside and get in my car. I went to get in my car, and the battery died.
Oh my God. One of those days.
Yeah, one of them days. And so I called AAA, and while I was waiting, I just went over to the piano, and I just saw a little bird. He was sitting outside the window. He was going, wow, hold on, hold that thought. Well, I'm not going to be able to whistle too good. Anyway. There's a little red bird in a tree, and all day long he sings to me happy song, happy song. And every night in my bed I keep hearing in my head happy song, happy song.
Yeah.
Don't go crappy. Cause when you're happy all day.
That's the way to end it. So and thank you so much. So if somebody wants to reach you, what's the best way?
Well, if they're interested in coaching or working with me, the best way is just go to menopausecoaching.com, and my website's drmache.com for any other thing else, but menopausecoaching.com is probably the best way.
Thank you so much. Yeah, I really enjoyed your wisdom, but as well your humor and your positive attitude in life, despite all the difficulties that I know you and your wife went through. So thank you for coming, Mache. Really appreciate it.
Thanks for the opportunity to get to spend some time with you, and it's been a pleasure.
And thank you for joining us at Curious Remedies and Beyond, exploring science and the wisdom of health and healing. We hope to see you next time.